Right off time. So welcome everybody. Hope everyone is doing well. I apologize to all of you. As we were saying before, it's 70 degrees and sunny for like the first time in forever in Rochester, and all of you chose to be here. So either you're just sadists who just can't get enough of pain and torture, or you really don't know how to windows in your office. But either way, glad to have you. So lots of information today, lots of updates about vaccines in general, and kind of where we stand. So, but I still don't think it's going to take us the full time for certain. So we can flash over to the Excel spreadsheet. Numbers are interesting. We're and I think the constant discussion has been that we're in this race. Can you go to full screen on that, Kevin, or does that mess everything up? If you go to slideshow on it. If it doesn't work. That's fine. So, we started to see this kind of up climb. Now it seems to largely have plateaued in most areas. Now you'll see in Monroe County, we're still on a lower upward climb of positivity. There has been some discussion that more and more I should say less and less, we're seeing people coming in for asymptomatic testing. So we had this kind of glut of asymptomatic testing that was uh, constituting a higher percentage of our testing volume, but now it actually has been more people who are coming in for ED visits or urgent care visits or whatever the case may be. So it doesn't necessarily surprise completely that those folks are going to be more likely to be positive than those who are coming in with kind of random asymptomatic testing for travel or what the case may be. And Kevin just doesn't like my spreadsheet at all, so he just decided to forward on. So, the 2.6%, no, we're definitely still seeing a higher trend than where we were. In the last 4 to 6 weeks, about 30% of all cases that we have gotten back. So there's probably another couple weeks lag in there, but have been variant cases, of which the UK variant is the predominant variant. So we definitely do have variant cases circulating in the community. So we know that. However, while it does seem to be a younger group that is presenting, probably partially because the older group is more immunized, and probably partially because the younger group is doing more travel and exposure and getting frustrated with masking policies and whatever the case may be. We are not seeing, although the hospitalization rate has gone up slightly, kind of bumps up and down, we're certainly not seeing the significant ICU mortality, all of that we were before. And certainly in our affiliate hospitals, if we look kind of across the region, they're seeing maybe 1 or 2 cases. Many of them will go down to 0 here and there. So we're still not seeing huge density of cases at this moment, which is good. Nationally, you can see, we were kind of bumping, and then now we're kind of on this downward trend, which is great. Statewide, we still seem to be fairly stable, but we're just kind of on this new plateau, if you will, that we've really never seemed to come off of since the big surge over the December, January time period. So still kind of keeping an eye out. The discussion that it's a race between the vaccine and the variants probably is never more true than it is at the moment. All this discussion of 30 more days probably could not be more realistic. So everyone probably heard on Sunday, reporting from Saturday, we topped 4 million doses of vaccine administered in a 24-hour window. We are now routinely exceeding 3 million doses of vaccine administered per day across the US. So that's terrific. So we definitely are getting shots into arms. We anticipated that this week was going to be when we saw a flood of vaccines starting to hit the region. It hasn't come to fruition yet. The anticipation is that flood may be next week. So it's been a little bit more of a trickle this week, but we are starting to see a little bit of dissemination from county health departments and the like, where vaccine is kind of getting secondarily into, especially some more of our regional sites. The good news is, as of today, 38% of adults in the Finger Lake region have been vaccinated. So that's excellent. Ontario County has taken the lead at 43% in the Finger Lakes region that is vaccinated. So that's pretty dramatic. And based on our current progress, the estimation is that if herd immunity takes 80%, that we should be able to achieve that by mid-June. So we're really only looking, a couple months down the road until we're in that 80+% of folks, eligible folks vaccinated, which is pretty tremendous. And truthfully, with more vaccine getting ready to come into the region, that number probably will only accelerate further. So that's based on current supply and distribution of vaccine at the moment. So all that's really good news. Things definitely seem to be heading in a positive direction overall, although the variants are there, so we can't ignore it completely. Now we can go to the graphs. Not terribly new or interesting on the graphics. The only thing that I will point out in that hospitalization, in the last week or two, there has been a slight net increase in hospitalized. Now we're talking about a total of about 10 or 15 more hospitalized cases across the entire Finger Lakes region than there was 2 to 3 weeks ago. So it's not dramatically increased, but it definitely has caused that kind of scooping effect. When you look kind of day to day, it bumps around a little bit. We did have one day where we had like 16 COVID discharges and it seemed to kind of plummet off, but then it bounced right back the next day with presumably new admissions. So, kind of keeping an eye there. The good news in all of this, and one of the things that is potentially helping with the outbreaks the most, is we are not seeing, likely again because of vaccination, the outbreaks in nursing homes and congregate living facilities. So in many communities, that was driving these little hot pockets of cases, and we're not seeing that anywhere near where we are now. If we go to the next graphic, I don't think that tells us much else either. You can kind of see that new plateau as far as cases per 24 hours, where we just kind of seem to be riding that new curve at the moment. If we go to the regional data that Nick shares with us, again, new plateau. So we're nowhere near where we were back in December, January, but we really haven't come down either. So we're just kind of hovering in that zone at the moment. So just kind of keeping an eye on things. I will say, and this has come up, a couple folks actually reached out to me. Southern Ontario in Canada has had a bit of an outbreak, and they've gone back into a shutdown mode again because of it. So there's a lot of obvious complaints amongst the citizenry about that, but there was some concern that would that flow across the border, especially as you can see, Erie was seeing a bit of a surge. Now there's not a lot of cross-border traffic at the moment, so there's no reason that should be a huge influx. But there wasn't a great explanation that I heard as to why Erie in particular saw the mini surge that it did over the last couple of weeks. But it does seem to be curbing a little bit, again, at the same time that we are seeing the shutdowns in Ontario now. So more to come on that one. I think that's all I have to say about that. The testing, I said, we are seeing more variants, as much as 20 to 30% of cases are now variants. Again, when I say variants, it is the generic variant. So there are, I can't even remember now, I think there's 20 plus US variants, most of which have no increased virulence, increased contagious capabilities. The UK and South American variants are definitely the ones that we're following. So every state in the union has pretty much seen all of the different variants at this point. We have been fortunate in Western New York. We really have not seen the penetration of the South American variant, which may be the most virulent of the variants currently out there. The British variant definitely increases transmissibility. There may be an association with increased severity of illness, certainly in the over 55 category, but that's more observational data and has not been proven out fully at this point. But of the bad variants, if you will, the UK variant does seem to be the dominant variant in our region at the moment. So more to come on that. Whereas before we had a trickle of variants, we clearly have seen more variants now than we did before. And testing, certainly remains very available. They continue to, in Monroe County, amend the testing site, the drive-in, drive-out, ease of access And from what I understand, that's going very well for folks and is very efficient. So again, the question of need for office-based testing, at least at the moment, probably doesn't seem to add much in the way of efficiency, just given the availability and ease of access for most folks. Now on to vaccine. So several pieces. First, something that's seemingly starting to penetrate the popular press. So Pfizer has come out with data, I think about a week ago, that said at 6 months, their antibody titer levels remained fairly strong and unchanged. So yay, Pfizer, that's great. Moderna just came out, I think it was Monday or Tuesday, with a 6-month study that did show a beginning of a waning of antibody titers, especially in the 56 and older category. So why 56? I don't know. They could have made it 55. They decided 56 was the group. So nonetheless, there does seem to be some waning of antibody titers at 6 months in Moderna. And the but is not getting carried in the popular press, unfortunately. What we are still not fully understanding, and there's a lot of scientific work being done on this, is the T cell immunity seems to be very strong, even as much as 9 to 12 months out in that initial population. So when they do get re-exposed, they do develop a secondary antibody generation, but they don't maintain a circulating antibody titer quite as vigorously. So all that is to say, the immune response remains strong, but the antibody titer may be lower and may not be necessary. Again, I didn't do very well in immunology in medical school, so I'm not the guy to tell you about that. But I do remember that T cell immunity seemed to be an important thing. And it sounds like the T cell immunity is working pretty well. So that's the guy that barely struggled to pass immunology in medical school. Summation of that whole story. But patients are probably hearing, and we already knew, much to everybody's surprise, the population that is now requesting vaccine disproportionately seems to be chasing J&J. And this is now going to potentially be adding fuel to that fire to say, I can't get Pfizer because Pfizer is not as readily available at the moment. Moderna is my other option, but I heard Moderna doesn't last more than 6 months. I want the J&J. We don't have 6-month data that's widely published for J&J yet, so we can't really do an apples to apples comparison. But as best we can tell, it looks like all of them still maintain pretty robust immunity. And if you listen to the Faucis and Walensky's of the world, the general summation is that we will probably need yearly boosters, much like we do with a flu shot. But that the anticipation is that all of these vaccines will likely provide 1-year immunity. So that's that piece. If you start hearing that in clinic, yes, the antibody titer does seem to wane a little bit over the age of 56. However, it does not seem to correlate with any loss of immunoprotection or development of severity of illness. The other thing, there's been a bit of a discussion. A few folks have reached out to me, and there was some discussion even at the MCMS level about folks who had been vaccinated and are more than 2 weeks from receiving their vaccine in our region who are now coming back COVID positive. So we actually asked the IP, infection prevention, and the lab team at Strong, all of the employees who have tested positive, at least for the last couple of months, have been employees who were not vaccinated or who not yet completed their vaccination series. So there had been no one who was more than 2 weeks out that they know of who had tested positive for COVID. There has been a report, I have not been able to verify it independently yet, but that there were 2 employees at Rochester Regional in the last week who are post their 2 weeks who developed a moderate, did not need hospitalization, but did have findings consistent with pneumonia after their vaccination. So a couple things I would say about that. We know that the vaccines have been at least 95+% effective at preventing severe disease. We know that Pfizer was probably closer to 100% effective at preventing severe disease. At 95%, that still means 5 out of 100 people that get vaccinated are going to develop moderate or less. So is it possible that those 2 people happen to work at Rochester Regional? Yeah, I got to say that's very reasonable. But those are folks who are still not hospitalized. If we were talking the flu vaccine every year and we had 2 people at Rochester Regional that developed post-influenza pneumonia, none of us, that wouldn't even like make it out of the break room at Rochester Regional, much less become a regional-wide discussion. So I still would contend that it's in keeping with everything that we know about the vaccine. But at least with the independent data that we have not seen any, at least from the folks who are being tested through U of R and their 30,000+ employees, of those who have been vaccinated, none of those have come back positive in the last couple of months. So in case you hear about that, it does seem to be kind of making its way through the rumor mill locally. That's the story on that one. Next piece of potentially trying news. AstraZeneca this morning paused its vaccine trial in children in Britain. So this was, I believe, 6 to 18-year-olds. The vast majority that had been enrolled to date were ages 6 to 11, is my understanding. They paused it this morning because of concerns around the issue around blood clotting with the AstraZeneca vaccine. Now, that's already gotten popular press. I looked this morning and it came up on several different news lines. Several interesting things to know. They were intending to enroll 300 people in the UK for that study. Pretty small study, 300 children, I should say. The estimation is they've enrolled probably about 200, 220 to date. They have had no reports of blood clotting issues in that 200 to 220. So they did not pause it because of incidents of blood clotting in children. They paused it because of reports and concerns about blood clotting in the UK in general. So this was out of an abundance of caution until that answer, or until it has been definitively answered. They did release data, I think it was the end of last week. Out of 15.8 million doses of AstraZeneca administered, there have been 30 incidences of blood clots that have occurred. Now, what would it be in 15.8 million people? Pretty doggone close. 7 of those 30 had central venous thrombosis in the head. That's a weird place to get a thrombosis, to say the least. They still do not have a mechanism of attribution to say why that would be due to the vaccine. But the data's out there. They're still doing yeoman's work to try to evaluate. Obviously, this does not help AstraZeneca's overall press in this whole story, because their plan was to next week go to the FDA for EUA, emergency use authorization in the United States. So one more punch to the AstraZeneca vaccine probably doesn't make that any easier. But again, obviously, folks are, we're probably getting close to Pfizer getting approval for the 12 to 15-year-olds because their vaccines had such high efficacy with really no adverse outcomes whatsoever. So we are likely to see the 12 to 15-year-old group get added in the not so distant future, potentially. But as there's going to be this push to, when can kids get vaccinated, I'm sure the parents who are predisposed to have concerns will probably see that AstraZeneca trial result and get very concerned. But again, AstraZeneca is not available in the US. We don't know when and if it will be available. Our current vaccination strategy does not rely on AstraZeneca being available to meet the number needed to vaccinate. We have 800 million doses planned for this year that we'll be able to administer, regardless of what happens with AstraZeneca. We only have 350 million people in the country. So 800 million doses allows us to talk about 12-month booster dosing and all the rest. So long story short, AstraZeneca is important for international vaccination plans. Obviously, it does matter for global herd immunity, but it is not central to U.S. vaccination strategy at this moment. And it's not even clear that this concern about blood clotting disorders is really attributable to the vaccine, or it's just a large vaccine trial that happened to see some adverse outcomes in a paucity of patients. So take that for what it's worth. We'll probably hear more about that in the coming days, but obviously the popular press is just picking up that AstraZeneca has again been paused in the UK, which obviously doesn't do good for overall vaccine hesitancy across the country. So continuing on, everyone knows that we are now into anyone over the age of 16, obviously 16 to 18 is Pfizer only, 18 and over, come one, come all, can get vaccinated. There is actually more availability for vaccination in the community than there are people taking the spots. So there is real concern. Whereas used to be a couple weeks ago, they could fill a vaccine clinic within hours. It is now taking days. And I can tell you, having just talked to Mike Stapleton from FF Thompson, their vaccine clinics for Thursday and Friday, they still have about 50% availability and have not yet filled them. They just filled their vaccine clinic for today at like 1 o'clock this morning. The last spot got taken. So it is running closer and closer to the wire. And we're anticipating, whereas the regional hospitals, sans FF Thompson, I think, got no vaccine distribution this week. Next week, the anticipation is that each one of those hospitals will get 500 doses, and the county health departments, the state pods, all will start to see an increase as well. So with that, there's going to be even more vaccine flooding the zone at the time that we're having trouble filling the existing vaccine clinics at this moment. So if patients are reaching out, it should be very easy at this moment for them to find a spot to get vaccinated. If not this week, then certainly next. And next week, it should become easy for just about anybody that'll take it. But the hesitancy discussion still does persist. Fortunately, as we said before, the rural and evangelical populations have started to see the biggest increase in hesitancy. I think there were 5 prominent evangelical ministers who all released a statement yesterday suggesting that folks do get vaccinated. So the more hopefully folks in these communities hear from people that they trust, hopefully the more of that we will see occur. Okay. So the only other thing I've got is, as much fun as all this is, and as there does seem to be a trickle of information, it does seem to be that we are reaching a point of slightly diminishing returns. So what we were going to propose is going to an every other week cadence at this point, which would mean we would skip next Wednesday and then be back on Wednesday the 21st, I think it is. And then obviously we'll still do our regular email updates. And if the COVID world explodes and we need to go back on at a moment's notice, fortunately, this is just a Zoom and we can turn this on just for fun. And if you miss us, you're welcome to drive by the AHP office or call us and we can do COVID calls at your leisure, one-on-one. But for now, realizing that the warmer weather is coming and people have other things in their life that they're trying to do, and probably for some vacation season coming upon us, we thought that it probably made sense to decelerate a little bit, barring any unforeseen changes in the COVID world for the moment. And I don't see anybody in the chat room saying, oh God, please, no, we love this, please do it more. So I don't think anyone's too brokenhearted at the moment, but if you are, we will await to see your chat room or verbal response. All right, so with that, LJ, do you have anything?
I do not have anything unless there are questions from the group. I have nothing to add.
Anybody else have questions, issues, concerns, things they want to bring up? All right, hearing a lot of quiet. Everybody wants to get out in the sunshine, which I do not blame you. So enjoy the day. We will see you in 2 weeks. The behavioral health calls will maintain their current cadence for now, so that will be unchanged. But we will see you back in 2 weeks. And if anything else changes before then, of course, we'll communicate electronically or otherwise let you know if there's a need to reconvene sooner. So thank you, everyone. Have a lovely 2 weeks, and we'll see you back soon. Take care,
Bye, everybody.